Good afternoon, everybody. Today we're going to learn how to take our client's blood pressure the old-fashioned way with a sphygmomanometer. Now, what is a sphygmomanometer, you may ask? This is the piece of equipment that we're going to use as caregivers to take our client's blood pressure. Blood pressure is considered the silent killer because most of us do not take it often enough. So a very good skill for caregivers to learn. So the sphygmomanometer consists of the cuff that we're going to pump up with air. This cuff is positioned approximately 1 inch above our client's brachial artery, which is in the crease of our elbow. So the cuff would come approximately 1 inch higher than the brachial artery. That's the positioning of the cuff that we want. And it tells you how to line up the little arrow here. It actually says artery, so you would line that arrow up with your brachial artery 1 inch above it. The other pieces of a sphygmomanometer is the rubber pump that we are going to pump up the manometer with. So when we start pumping this rubber ball, this little red arrow here is slowly going to climb around the dial. And because the average human being has a blood pressure of 120/80, we want to make sure we're going 30 or 40 notches over 120. So try to pump this dial up to approximately 160. When it gets to 160, stop pumping. Turn this little dial a little bit counterclockwise until you see the little red arrow slowly start to decline to come down. It should be coming down 1 notch at a time. Each notch represents 2 millimeters of mercury for your client's blood pressure. The blood pressure that we're actually capturing is when the heart pumps, it pumps blood against the walls of our artery, and we're capturing the force of that with our blood pressure reading. The manometer does that. And when the heart relaxes, we're also capturing the force against the artery walls, giving us 2 separate numbers. The top number we call systolic, the bottom number we call diastolic. When this cuff is on your client's upper arm, 1 inch above the brachial artery, you're going to use a stethoscope, the other piece of equipment we need to take our client's blood pressure. And we have 2 earpieces go in our ears, connected to the binaurals, connected to rubber tubing. Some of these are plastic, but this one is rubber. And we're going to listen through the diaphragm here that goes directly over our brachial artery, and we're going to hold that in place like so. And you should hold it with your fingers because your thumb does have a pulse, so you want to make sure you hold it with your fingers to get an accurate reading. Now, the average human being has a blood pressure reading of 120/80. So when we pump this ball up and the manometer is showing 160, we're going to release the air out of the cuff, and we're slowly going to watch the red arrow. The red arrow is slowly going to come down, and we're going to listen very carefully for a sound that kind of sounds like lub-dub. When we hear that sound, lub-dub, we're going to look at the red arrow and keep in mind what number it's pointing to, and the cuff is slowly going to deflate, and we're going to continuously hear the sound lub-dub, lub-dub, lub-dub. When that sound stops, you're going to take the second reading, whatever the arrow is pointing to, when that sound stops. It's very difficult maybe at the first time you do it. You have to get used to it. Don't be afraid to tell your client to be silent while you're doing it, and make sure the environment is quiet as well so you can hear the lub-dub sound. So again, the first time you hear lub-dub is going to be your top number, systolic. When the sound lub-dub actually stops, that's going to be your bottom number, diastolic. That's kind of the old school way of taking blood pressure. Now, 120/80 is normal or average for a human being. If your client's blood pressure gets up to 135, 140 for the systolic number, or 90 for the diastolic number, the doctor could diagnose hypertension, high blood pressure. Or the opposite would be when the systolic number gets down to about 100, or diastolic number gets down to about 65, 70. Doctor could diagnose hypotension. So hypertension is high blood pressure, hypotension is low blood pressure. If you find your client's reading too high or too low, please tell your supervisor right away so they can get a further assessment. And that's basically how you would do old school blood pressure. A lot of you have probably seen the automatic cuff machines, or you put the cuff on your client's arm and you push a button and it takes your client's blood pressure. Most people think the old school way is more accurate. So it's a very good skill for PSWs to learn. If you can use or invest in the blood pressure taking equipment that I just showed you, it is a good skill for you guys to learn. And I hope this video was helpful for you guys. If you liked it, please like, share, and subscribe. And I'll see you next time on JoJo the Caregiving Show.